Thank AOS and Allergan for giving me this opportunity. So now we are in the era where there's a lot of misuse of drugs, because of which there's a lot of multi-resistant organisms in the world. And in fact, if you look at the stats in 2050, there's going to be a big jump in the number of deaths which can happen because of these multi-resistant organisms. So customized treatment or personalized medicine is extremely important in this from now onwards. So how do we do this? So let's play a scenario where I'm sure each one of us have had cases where post-surgery you see these reactions in the eyes, and during the early stage, you keep wondering whether this is a sterile one, is it infective? If it is an infective one, is it a bacterial, viral, or fungal? Some of us think, some of us be very aggressive in the treatment, or some of us think, okay, let's wait and watch and see what happens. Then eventually you get a picture like this, and you immediately rush the patient to the OT, do a very invasive AC tap or vitreous tap, and send all this to the lab. This is a very invasive, very inconvenient for the patient, and also it's very, it is expensive, and also it takes time for the report to come back to you. And in these scenarios, a missed or a delayed diagnosis can lead to blindness or loss of ocular architecture. And early detection is the key in such scenarios. So the research question is, can we do a non-invasive, quick, simpler, affordable test? And we found something very novel. We call this the TED. TED referring to tear endophthalmitis autoimmune detector. So the aim of the study was to do a tear of endophthalmitis detector of infective etiology and its correlation with conventional microbiological testing. So these were the objectives: is to study the tear profile and correlate with endophthalmitis, to study the microbiological profile using standard lab tests, comparison of the results with microbiological diagnostic methods, and also study the correlation with tear profile using metabolomic profiling. So this was the inclusion-exclusion criteria. We excluded any kind of a lid abnormality. This is how the methodology looked at. We did a detailed ocular and systemic examination. Sample was corrected of the tears, aqueous, and the vitreous, and different analysis was done. Basically, we did the gram stain culture, PCR, and UPLC mass spec. This is how the sample preparation was done. I won't go into too much detail because of a shortage of time. And this is how the data was analyzed. So the expected outcome was quantification and identification of metabolic regulators, and also identification of key metabolic pathways. So here you can see differentially expressed metabolites in bacterial endophthalmitis. And here you can see a supervised cluster showing a distinct separation pattern between bacterial and control group. Here you can see a heat map showing major differences in expression in metabolites in control and bacterial endophthalmitis cases. So this is the list of altered metabolites. We had similarly, we found something very unique: altered metabolites in viral endophthalmitis and fungal endophthalmitis. So what was already known was diagnosis of endophthalmitis is based on clinical examination supported by microbiological investigation. What this study adds is an altered metabolic pathway in tears in endophthalmic cases correlate with those found in aqueous and vitreous. And tear metabolic profiling may be able to identify endophthalmitis, may serve as an early diagnostic modality, obviating the need for invasive testing. So how do we use this in our clinics? So basically, we're developing this diagnostic kit with which just by, let's say if you suspect some kind of infection in the eye post-cataract surgery, and you can collect the tears with these Schirmer strips, put it in this diagnostic kit, which is going to be very affordable, portable, and you can keep it in your own clinic. And within 30 minutes to 1 hour, you get the results in your hand, and that way you can start the treatment very early. And obviously in these kind of scenarios, earlier the treatment, the better the results, and patients sometimes you don't know that something went wrong. So let's look at which other scenarios can we use biomarkers in terms of treatment. I'm sure each one of us have had cases like this where before surgery itself, patients had some kind of retinal pathology. And not all the cases, but some of these cases worsen post-cataract surgery. So the research question was, can we predict before surgery which patients can have worsening of retinal pathology post-cataract surgery? So we did a prospective interventional case study wherein we did the follow-ups at 1 month, 3 months, 6 months, and 1 year. And these were the inclusion-exclusion criteria. And it was we divided into 2 groups. First, based on systemic illness, where group 1 had only diabetes, group 2 had only hypertension, group 3 had both hypertension and diabetes. And the next group was based on whether there was presence or absence of retinal pathology. So if you look at the results, there was a significant increase in VEGF and MCP1 in patients group which had both the diabetes and hypertension. And also there was significant increase in VEGF and SFAS in patients and other inflammatory markers in patients who had worsening of retinal pathology post-cataract surgery. See, we correlated these findings in the tear film also. So basically now we know that post-surgery, post-cataract surgery, sometimes there can be worsening of retinal pathologies, and there are certain biomarkers to help you to identify these scenarios before the surgery itself. So like I mentioned earlier, there was in patients with who had both diabetes and had hypertension had significantly higher levels of VEGF and MCP1. And there was higher levels of VEGF, MIG, L-sectin, and other inflammatory markers in patients who required some kind of retinal treatment post-cataract surgery. So this is our concept where we identify, isolate, and do customized treatment for these patients. So basically, we have developed this very unique, novel diagnostic kit, which is small, portable, and you can keep it in your clinic. And these have these cartridges or the chips, which depending on what biomarkers you are interested, we can customize those chips and give to you. So how do we use this kits in our clinic? Again, so let's say if your patient is undergoing cataract surgery, we collect the tears of these patients and then process it and put it in the cartridge. And once you put in the diagnostic kit, within 90 minutes, you will have the report in your hand, and you can easily identify which patients can worsen post-cataract surgery. So that way, it is so much more easier to explain to the patient, or explain the prognosis to the patient, saying that, see, there is a very high chance of you your retinal condition to worsen after the cataract surgery, and also you can do some kind of a preventive measure. Let's say a preoperative itself, you can make the patient to undergo a strict control of systemic illness, and also you can plan some kind of intravenous injection depending on the retinal pathology. And then after a month, you reassess the patient and then go ahead with the cataract surgery. And these kind of patients, you can do, a close follow-up with the OCT and FFAs, watch for any kind of inflammatory sequel, and also stress on the fact that they have to continue, a very, very strict systemic control of the disease. So we have moved to a new dawn where we do customized treatment with the help of biomarkers, not just for the patient, in fact, for the eye itself. So what was known was specific biomarkers point towards certain retinal pathologies and can be used for screening tool for early diagnosis. What this study adds is a non-invasive diagnostic biomarkers, a point of care of diagnostic kit in cataract surgery to help predict prognosis and early diagnosis of retinal pathology, resulting in better cataract surgery outcomes. I thank you for your time.
Thank you, Naren. I think